Hi, this is Reggie from Restore Plus Physical Therapy, and welcome to today's video. In this video, I want to show you three things that are very effective in helping and treating your frozen shoulder when all else fails. Now, frozen shoulder is something that I see is not as common as back pain or neck pain, but I see it quite a bit. Why? Is because when people start having shoulder pains, they tend to just protect their arm. They tend to immobilize their arm and not use it. Doing this for a prolonged period of time, then the shoulder starts getting stiff and you start having what they call a frozen shoulder. Now, that some studies have shown that frozen shoulder goes away on its own in like a year or so. Now, the question is, do you want to wait a year before your shoulder pain, your frozen shoulder goes away, right? I know I don't, right? I'm not waiting a year. I mean, that's an eternity for you not to be able to use your arm, for you to be in pain, right? Because this can affect your livelihood. It can bother you at work. It can prevent you from taking care of your family. Like for me, I have a little boy. If I have frozen shoulder, I won't be able to lift him up. I won't be able to, play with him, and that's not something that's not acceptable for me. All right. So I'm going to show you three things that will be very effective in treating your frozen shoulder. So first is I want to give you just a basic idea. I'll introduce you to, some of you may have known Freddie over here. He's my buddy. I use him in a lot of my videos to just demonstrate a few things. Well, as you can see, this is the shoulder. So the shoulder does a lot of movements. It can go up, side, and then it can rotate up, rotate down, reach back. So it's a very mobile joint. It's not very stable, but it's very mobile. Right? So now, when you have a frozen shoulder, just imagine you have rust in that joint. So it's gonna prevent you from going up. It's gonna prevent you from going side. You won't be able to reach across your body. So imagine this is just, a rusted pipe or something, and it's not moving too much. So imagine that when you have a frozen shoulder. All right. So let me just put, Freddie back here. I just want to make sure I put him in safely, that he doesn't fall off. All right. So let's jump into what are those three things that can effectively be done or you can use to treat your frozen shoulder. So first one is you can use like a foam roller like this. This you can buy this from some sports shops, Amazon, and it doesn't have to be fancy. I know some of them cost 70, 80, some of them even $100. Something like this cheap costs, I think, what, $20 or so. It's good enough. So what do? You can put this against the wall, or you can actually put it on the floor and lie on it. That tends to be more painful. If you can tolerate that, yes. But if not, the wall would be good. And for us, it's easier to demonstrate it like this. And compared to lying down, I try to not give people too many excuses not to do the exercise. You can just find a wall, and then you can put it kind of here. I want you to target the lats muscle here, which is the muscle underneath here, the armpit area. Okay, so let me get this. I have a diagram here. So this is this area here. This is your latissimus muscle. All right. So now with this muscle here, you want to work this muscle. Now, how do we do that? You can use this foam roller. So you'll be facing kind of sideways to it and put it like in that area there. Lean towards it. So let's say you have a frozen shoulder, so you're not able to go up. So just bring your arm up as high as you can. Let's say only up to here. All right. So you're leaning on the foam roller and you can roll it up and down. All right. So you can adjust that. So roll it up and down. Usually you're gonna find a spot there or a couple spots that are very painful. You target those spots. You put pressure on it. You can hold it for like 60 seconds or something. Then you can roll to the next area. Or you can actually just kind of roll it up and down. And as you do this, try to go, use your other hand to just keep pushing your other arm up higher and higher as much as you can tolerate. You can do that for like 5 minutes, several times a day. So that's one, because this muscle prevents you from reaching up. And this is tight, then it's going to be hard for you to reach up. So you want to release that muscle. But that's one. The second one is I want you to release or stretch the back part here of the shoulder. That's a posterior capsule. So I want you to reach across the body like this, right? Put your hand in the arm here or in the elbow area, okay? And then just press it towards your chest. Now, a lot of my patients, they ask me, do I keep my elbow straight? Do I keep my elbow bent? It doesn't really matter. I tell them, just relax. Most important part is you get the stretch here. So you pull it towards here, you feel the stretch, hold it for like 20 to 30 seconds, then you do it 3 times. All right, so that's the second one. The third one is when you have a frozen shoulder, very common is rotation of the arm is affected. You won't be able to reach back, you won't be able to reach to the head. That's very commonly affected. So how do we help improve that? You can do this lying down, which more commonly I have patients do, but you can actually do it against the wall too. If you can, bring your arm straight like this, or 90 degrees, okay? And then you just kind of lean against the wall here, and then use your other hand to actually push it up. Usually going up, your forearm will be able to touch the wall, the back of your hand will be able to touch the wall. That's normal range. If you cannot, then you go, let's say up to here, just hold it there, or let's say up to here, just hold it there, right? As much as you can, just keep going up then. You're gonna feel pain, yes. Hold it for 20, 30 seconds, then you can do it 3 times. Aside from that, you can go the other direction also, which is going this way. Same starting position. You lean towards the wall here, so you stabilize the shoulder, and then you go down. This one, you don't have to be able to touch the wall like this. As you can see, I have normal range in my shoulder and I can't do it. Some people can, but you don't really have to. That's not what's needed to be considered normal. So just go down and you feel the stretch. How far do you go? Most of the time, 70 degrees is considered the normal range. And you push and hold it again. So just go as far as you can. And then you relax. Hold it 20 to 30 seconds. Do it 3 times. And you can do this 2 to 3 times a day. And that will help you keep stretching that shoulder and increase your range faster. All right? So try those. See if it helps. Now, if it doesn't, then I would recommend seeing a specialist like us, and we can help you further. Because remember, these exercises you can do, but sometimes conditions are bad enough or they're severe enough that these home exercises are not enough to help you. Then that's when we come in. We'll be able to evaluate what other factors are involved, what other imbalances are involved there that's causing your shoulder to not move. All right? So once we determine the imbalance, then we'll be able to formulate a plan, a more extensive plan that will include different movements and manual therapy and some modalities such as the revolutionary laser. So those are things that we can use to help the patients get pain less pain faster and get more range faster. All right? So those are things that you can try and do at home. Let me know what you think. I would love to hear them. If this means anything to you, leave your comments below, leave your feedback below. Feel free to share this definitely with your family and friends. And you can like us on Facebook, follow us on Instagram, or subscribe to our YouTube channel so you can get more tips and on different topics. And I will see you on the next video. Stay safe, stay pain-free, and always remember, you're awesome. Bye.